There's actually a couple of interesting studies that have come out about doctors that are sort of worth talking about. Before I get into them, we need to talk about doctors. I'm not anti-doctor. I know there are many in the alternative health community who are. I'm not. There are definite things that doctors do that an herbalist can't do. The problems I have with doctors are that they have set themselves up, and the AMA has set them up as the only, not even necessarily the best, the only arbiters of health in the world today. You're either dealing with a doctor or you're dealing with a quack by their definition. And they then have set themselves up as the arbiters of wisdom in all areas associated with health, even like nutrition. Despite the fact doctors don't study nutrition. They take, on average, one class in medical school. And that's not one class a semester, it's one class total. And they basically do, they'll meet 1 hour a week on that class for 6 weeks. So the average physician is getting, well, maybe a little more now, but it used to be 6 hours total of nutrition in medical school. And yet they are determining your health and nutrition. It's not the dietitians in the hospitals. Understand that you go to a hospital, the food you're getting, it's what the doctors are telling the dietitians. Dietitians may be fine-tuning it, but if doctors wanted different food, live foods, healthy foods, organic foods, they would be in the hospitals. Doctors, again, are final orders in every one of these decisions. That's the problem I have. That said, let's talk about the first new study, which found that physicians do not always, and I use always in quotes here, in fact, rarely inform their patients voluntarily of all the possible health hazards that their treatment might cause. The study took place in Australia at the University of Melbourne, but it was conducted by a team of scientists from both Australia and the U.S. So they were studying, it wasn't just Australia, they were studying how it would affect or how it deals with physicians basically worldwide in the developed world. The researchers evaluated a number of claims of malpractice as well as official complaints by Australian patients. Every one of them, every single complaint was centered on an allegation of inadequate informed consent because of lack of risk disclosure. The vast majority of cases, 90% in fact, pertained to disagreements over exactly what the physician said prior to treatments. In 9% of the cases, the argument was directly about whether the possibility of a certain risk should have been discussed with the patient before the procedure. These situations that were referred to as disputed duty cases, 2/3 revolved around surgery. And nearly 85% of them had to do with 5 specific outcomes. So we're talking about 85% of all the lawsuits, all the complaints, everything had to do with 5 outcomes, which was patients weren't told they might need a second surgery, that they would be left with chronic pain, that they might get poor cosmetic results, they might end up with loss of vision or hearing, or they might end up with infertility or sexual dysfunction.